Because the Inflation Reduction Act, we're talking about life-saving steps to reduce health care costs. It locks in place the lower health care premiums for millions of American families under the Affordable Care Act, saving them an average of $800 a year. And I see my friends in the Congress who saw that, in the Senate and House, saw that make that happen. Plus, we pay more for our prescription drugs than any country, major country in the world. The product made here in the United States, sold in Montreal or Paris or anywhere around the world, is cheaper than it's made here where it's been produced. For years, many of us have been trying to give Medicare the power to negotiate lower drug prices, which will reduce, by the way, the federal deficit at the same time. Because when Medicare doesn't have to pay the high price, guess what? It cuts your taxes. It cuts the amount of money the federal government has to pay. For years, Big Pharma won. Big Pharma blocked us. But not this time. I know I don't look it, but I've been around for 400 years. And I've been fighting pharma on this since 1970s. No, not a joke. This time we finally beat Big Pharma. Medicare finally has the power to negotiate lower prescription drug prices like the Department of Veterans Affairs has had the power. That's not all. You've heard it's already spoken to. Insulin. Companies pay, it costs, by the way, the guy who invented the insulin, he never patented it because he wanted it available for everybody. It never was patented. And guess what? It costs $10 to make, and if you use everything, including packaging, it could be as high as $12.50. Now those companies are charging 30 times that amount. Now seniors on Medicare, and by the way, it should be beyond seniors on Medicare, but I'll come back to that in another time. We're paying as much as $400 a month for insulin, and they're now just paying $35 a month. We're also capping total out-of-pocket expenses for drugs for seniors in Medicare to $2,200 a year, $2,000 a year for even the expensive cancer drugs that could cost as much as $10,000, $12,000, $14,000 a year. Combine all the costs of their drugs by 2025, they'll never have to pay more than a total of $2,000 after 2025.